Hi, I'm Becky. I'm a BABCP accredited cognitive behavioural psychotherapist. How can eating disorder treatment be adapted to better address the needs of neurodivergent individuals within the LGBTQIA+ community? There's so much I want to say about this question. There is a high prevalence of neurodivergent individuals within the LGBTQIA+ community. I'm myself a member of this community, and during my NHS eating disorder service experience, I felt there was more that could have been done in this area, with some acknowledgement of the issues, but a lack of clear plan of action to support this. LGBTQIA+ needs an intersectional, nuanced and inclusive approach. A 2020 study from the University of Cambridge showed that transgender and gender diverse individuals are 3 to 6 times more likely to be autistic than cisgender individuals. A 2018 study showed that a third of respondents said their gender identity had been repeatedly questioned due to their autism. This leads to ongoing systemic prejudice towards neurodivergent individuals, as it makes assumptions that they're not competent enough to understand their own identity, and leads to bias and prejudice, which can then extend to making assumptions about food sensitivities and eating behaviours. There needs to be a recognition in healthcare services of gender identity and neurodiversity identity, and then there needs to be a recognition of the overlap between the two, and that these impact body image, sensory processing and social experiences. Having lived experience practitioners from these communities would help increase representation and relatability. I think clinical staff need to be on board with training workshops to improve cultural competence in this area, some more formal, some peer-led, as well as service user involvement, to get a broader range of knowledge of what is needed. Stigma, discrimination, bullying and minority stress needs to be recognised as part of assessment and treatment of eating disorders in neurodivergent clients within this community, along with recognition that oppression and abuse like this can be a trigger or risk factor for an eating disorder. It's important to show visible support within services, including rainbow flags and pronoun use. Creating a sensory-friendly environment by using soft lighting, minimising noise, and using sensory aids like fidget toys and weighted blankets in inpatient or day hospital settings would be helpful if this isn't already available. Body dysphoria needs to be addressed in ways that affirm the client's gender identity and avoid binary language around bodies and weight, for example, male and female norms, and acknowledge the impact of societal expectations on LGBTQIA+ individuals. I definitely think this isn't happening at present in mental health services from my experience of working in them. High rates of trauma occur in both neurodivergent and LGBTQIA+ individuals. I would ensure treatment is trauma-informed and staff are trauma-trained. Using somatic therapies and EMDR would be amazing to support with this, which I currently do in private practice. Adapting CBT for neurodiversity processing with cultural competence. This could include breaking tasks into smaller manageable steps and allowing flexibility in food routines. Rigid thinking patterns like black and white thinking will need exploring to develop strategies to allow more adaptive flexibility. Group therapy or support groups specifically for neurodivergent LGBTQIA+ individuals with eating disorders could be important, providing a space where they feel understood and accepted. Systemic issues such as fat phobia, heteronormativity and ableism actually exacerbate body image concerns and eating disorders. We live in a society that rewards these systemic issues, so advocating for societal change will help with acceptance and reduce stigma for the LGBTQIA+ community. Using strengths-based approaches with individuals can help use hyperfocus, pattern recognition or other neurodivergent traits in therapy, along with emotional regulation techniques. This would be important too, including sensory grounding. Ultimately, it's important to ask individuals what is working and what isn't working for them. We need to validate and support diverse communication styles, including nonverbal methods. It's important to respect sensory and dietary preferences without framing individuals as treatment resistant. Collaboration and being person-centred gets better outcomes, and clients feel more motivated and empowered to make changes rather than having things done to them. Clinical research and more specifically, lived experience, the research remains sparse, despite it being critical for improving eating disorders care that is nuanced and individualised. There are documented overlaps between ADHD and autism, also known formally as ADHD, yet research through transdiagnostic approaches is rare regarding this overlap. A neurodiversity and gender-affirming approach is needed throughout services. We need to get rid of pathologising and stigmatising phrases that are from a purely medical model, such as abnormal, symptoms, deficits, impairments, tantrums, attention-seeking, dramatic, yet treatment-resistant or non-compliant. More affirming language would be traits, features, characteristics, support needs, differences, atypical challenges or difficulties. Love to see the low-high functioning phrase as well go too, as these perpetuate monolithic stereotypes that autism isn't just a linear construct, it has a dynamic and fluctuating nature. Improving accessibility and resources to eating disorder services is really important too. This involves removing barriers to meeting eating disorder services criteria. Simplifying referral processes could help with this, and provide online or in-person access to services based on individual needs. Use clear, jargon-free communication in all materials and during therapy sessions. Flexible scheduling would allow for more timing sessions or provide shorter, more frequent appointments for those with attention or processing challenges. It's important to educate families and allies with workshops or resources to educate loved ones about eating disorders, neurodivergence, and LGBTQIA+ issues, as well as advocate for rights to ensure equitable access to healthcare, addressing systemic barriers that disproportionately affect marginalised groups. Hi, I'm Becky Grace Irving. I'm a BABCP accredited CBT and EMDR qualified therapist and qualified mental health nurse. You can find me on Instagram at Becky Grace Therapy or at Becky Grace Irving on LinkedIn. If you'd like to learn more about my practice, check out my website, beckygracetherapy.co.uk. I've just spent the day filming with Mindfriend. Stay tuned for all our upcoming content.